we said May is for mental health, and here at KUTV, we are particularly very careful and very intentional to discuss matters mental health. And for that reason, tonight we bring Claire Omolo, who is a consultant psychologist, to help us understand this mental health issue and how we can go around it and how we can actually be in a better place to make sure that we get to, be on the safe side as far as the illness is concerned. The illness I'm talking about is mental illness, and we shall be discussing this further. Allow me to make a few references to other diseases in the course of the conversation so we can compare and contrast and see how we can tackle mental illness, which many people have actually taken for granted. So Claire Omolo, if you can hear me, welcome to this particular conversation.
Thank you, Mutegi. Thank you so much for having me tonight. I can hear you clearly.
Thank you. Amazing. Now let's get straight into this conversation. And this is not the first time we're talking about mental health in KUTV Kenya. We've done this in many settings, in many sittings, in many conversations. And the first question I always ask, for the sake of that one person that might be joining and has not taken time to define for themselves, to read or to get to hear someone like you speak, what is mental health? And what is mental illness from your perspective? And as you answer that particular question, it's important for us to also touch on now making a reference. As I said, I'll make a reference to disease like cholera. Before you know you have cholera and you go for testing, you will feel some pain in your stomach. So how does one, as you do this particular introduction, how does one actually know that they have a mental illness so that they can seek further help?
Okay, so let me begin by first defining what mental health is. So mental health is a state of well-being that affects how an individual feels, thinks, and even act. So when we talk about mental health, is an individual able to cope with daily life challenges? Are they able to socialize? Can they cope with the normal life stresses to a point that they're able to overcome each and every situation in their life? As well, is an individual able to achieve their personal goal and also make contribution to the society? Basically, that is what mental health is. So Mutegi, like we were discussing earlier, I wanted to tell you that when you wake up in the morning and you're able to brush your teeth, shower, go to job, then it means that you're mentally well. But an illness comes in when an individual is not able to wake up to do even the slightest of activities. When an individual finds difficulty in washing utensils, going to work, and doing even the things that they enjoy doing. So if you're an artist, you don't feel like singing anymore. If you draw, you don't feel like drawing anymore, then that there's a problem. And let me just say this in 3Ds. I call them 3Ds. So if you feel that you're distressed, number one, distress is basically you feeling extremely anxious and feeling extreme pain. So that is what distress is. Another thing is dysfunctionality, which I've been able to talk about. Like you're not able to function properly and people around you look at you and they see there's a problem. Then that is another highlight to see that you have a mental illness. And the last one is danger. Are you posing danger to yourself and the people around you? And by danger, I mean that probably you're having suicidal thoughts, ideation, or you've even attempted suicide, or you're threatening to kill another person. So in that, we'll say that you surely have a mental illness and you may need to talk to someone, a professional, about it for you to get care. Yes.
All right, thank you so much, especially for the 3Ds. I think they're really helpful in understanding where a person stands as far as mental illness is concerned. Now, you're a psychologist by profession, and the term psychology is really brought into the conversations of mental health. What is the correlation between mental health and psychology? Is it a branch of psychology? Is it Are they two topics? Are they two different topics? And as you answer that, kindly also talk about psychiatrist. What is the difference between a psychologist and a psychiatrist, and who am I supposed to go to if I find myself in a situation where the 3Ds are coming into play?
Okay, so let me begin by saying that psychology is broad. Psychology is a study that deals with the mind in correlation to how an individual behaves. So you actually have to go to school to study psychology. When we talk about mental health, like I defined earlier, it is a state of well-being, just like physical health. But now we are talking about mental health that determines how an individual copes with life challenges. So mental health also tackles the mind. So that is where the correlation comes, in that psychology talks about how we study the mind in correlation to the body, a person's behavior, but when you talk about mental health, what is your state of wellness, yeah? And are you able to deal with these challenges, as I said earlier? Another question that you asked, what's the difference between a psychologist and psychiatrist? So psychologists offer what you call therapy, different therapeutic intervention to individuals going through a mental illness. And not only that, there are different branches of psychology that targets even marriage, family, there's family psychology, among other things. But then psychiatrists, they've gone to School of Medicine and specialized in psychiatry, and they prescribe medication. So the biggest difference between psychologists and psychiatrists is that psychiatrists are actually doctors specializing in mental illnesses, and they offer medication, whereas as a psychologist, we offer what we call therapy. So who do you go to when you have a mental illness? Psychologists and psychiatrists work hand in hand. Okay. You see, like the individual's mind is broad, and in as much as a doctor will offer medication, that alone is not sufficient for an individual to get well. So the doctor offers medication, and me as a psychologist, I'll offer therapy. In therapy, let's talk about individual therapy, where I get to talk to you on a one-on-one basis, get to understand you more, even deeply, and spend time with you to get to understand where did this problem start, or when did it start, and then try to change your behavior through what we call talk therapy. So I think that is the biggest distinction, but we work hand in hand. Yes.
All right. Thank you so much for putting and having that distinction between the terms that really confuse the general public. Now, I'm going to make a reference again to an illness that is not mental illness. Let's take, for example, one of the illnesses that have really troubled the nations of the world. I'm talking about malaria. Malaria comes in many forms or types. Influenza comes in many types. Are there types of mental illness, or do we just have one type of mental illness? Maybe you can help us in shedding light.
Yeah. Oh, yeah. So I remember you had also asked about how does someone know that they have a mental illness. I think I forgot to say that. So let me begin by saying that we have different types of mental illnesses. I think most people know of depression because when COVID came, a lot of people used to say, you know, I'm depressed, I have a low mood. So depression is quite common. We have a manual for classifying mental illnesses that have basically classified these illnesses into mood disorders. So these mood disorders or mood illnesses, they're the ones that affect an individual's mood. And depression is an example, yeah? Depression is one of the mood disorders. We have anxiety disorders. Like if you hear someone has panic attacks or generalized anxiety illness, so that is another classification of mental illnesses. We have different phobias. You've heard of people who have these great fears towards things. Other people fear animals greatly. Other people fear insects, heights, water. So it's actually true that mental illnesses are classified differently. And for us to be able to understand what you're actually going through, then we need to take time to do an assessment. Like if you come to my clinic, I'll have to sit down with you, take time, assess you thoroughly, and also refer you to a psychiatrist so that you're actually able to know which illness you're suffering from. And you'd asked, how does an individual know that they actually have a mental illness? You'll be able to know. If you're someone who has a high level of self-awareness, you will definitely be able to know if something is wrong with you. Like if you loved dancing and you don't dance anymore, if you loved socializing, going out for events, and you no longer feel like doing so, if you have this great fear that when I step out of the house, I will probably have an attack or something of that sort, then that will show you that something is not okay. And also feedback. Feedback is something that is very important. If people around you tell you that they're looking at you and something is not okay with you, then I think you should take a sit back and analyze, why are these people actually telling me that there is a change in me? My mood is low. I'm probably not as outspoken as I used to be. So those are some of the things that can be able to tell you as an and there are also others that are just broad, like if you're now hearing voices or seeing things that we call hallucination. You'll be seeing things that other people can't see, or you're hearing someone talking to you yet people around you cannot see. So those are some of the things that can actually tell you that something needs to be checked. Yeah.
All right. We have like 3 minutes to go. I want us to go a bit faster because there are things I would like us to talk about before we leave this particular conversation, pending for the next conversation that is to come. Let's talk about diagnosis for a minute or so. What are some of the things you offer as diagnosis, a way of identifying the kind of the type of mental illness that one has, and how do you cure maybe a few types? Let's talk about maybe 2 types that you've mentioned and how you actually offer remedy to that particular problem.
Mm-hmm. So for us to come up with a diagnosis, or for me to come up with a diagnosis, first and foremost, I must sit down with an individual for a long time. It is not something that you just look at someone and say, yo, you're depressed or you have anxiety. So I have to sit down, listen to you carefully. What is happening? What are the chief complaints that you're presenting with? And for how long have you been experiencing this? Another thing that I have to do is look at various risk factors. For example, is genetics involved? Are you taking substances, or were you taking substances previously? Have you lost a loved one? Have you lost your job? So such kind of things will enable us know what someone is going through. And then we have different screening tools that help us as psychologists to also just verify that indeed this person has depression, or this person has anxiety, or this person has an eating disorder. So after taking a thorough clinical history, as we call it, then I will run also those tests and then be able to verify that indeed this person has depression. Like for depression, we have what we call Beck's Depression Inventory, which we use as psychologists, which I also use to just, fill in the fears that this is what I thought this person had, but then they indeed have it. So these questionnaires are self-administered, yeah? So how do we cure it? We have got various techniques that we use as therapists, or that I use, like we have what we call cognitive behavioral therapy. So once an individual comes in and says that they have depression, then depression comes in with a lot of negative thinking. An individual feels that they're not worth it. They develop a sense of low self-esteem. They feel like they want to end their lives. So the cognitive behavioral therapy technique is basically used to change an individual cognition, which in turn changes how they behave towards themselves or even other people. Also, family support is very, very essential and important. In as much as we do the one-on-one therapy session, we also try as much as possible to involve loved ones, because we know human beings are social beings. And so with the aid of a good support system, an individual can greatly come out of a mental illness and thrive, and even know how best to cope and deal with these life challenges.
All right. Thank you very much. As we wind up, 30 seconds, I'll make a reference to another disease that greatly affected the world, COVID-19. We had to put up centers everywhere to make sure we combat it from every side of the world that there can be. Let's bring it home. Let's come to Kenya and talk about mental illness. Do we have enough facilities? Do we have enough centers all over the country to tackle this problem? And if not, what can we do? Are we still on the journey to that, or do we have a long, long way to go?
Oh, let me begin by saying that we don't have a long, long way to go, because I feel that the government is doing a lot of sensitization, but at the same time, we have private facilities. Personally, I work at a private facility in Upper Hill called the Nairobi Mental Health Services, and as well as Doctors Live Kenya, which is an online platform that offer mental health services. So we are not far off as a country, but at the same time, what can be done is we can still do a lot of, sensitization, and we can also still talk to the government to create more facilities. One facilities that is greatly identified with mental health is Mathare, and when people hear the name Mathare, a lot of stigma comes in and all that. So if we have various institutions, and at least in each and every referral hospital, then we stand a high chance of curbing mental health issues. So I think what can be done is just a lot, and what we are doing right now, I think also sensitization comes a long way. Back to you, Mutegi.
All right, thank you so much for joining us in this particular conversation. Thank you for shedding more light on mental health. We're looking forward to have more conversations with you and your colleagues as we continue to push this agenda of mental health even beyond the month of May. Thank you so much for joining us.
Thank you as well, Mutegi.
All right, that is Claire Omolo. That is she's a consultant psychologist joining us to talk about psychology and psychiatry and mental illness, mental health, those terms that you hear. But basically, we're talking about mental health and seeing how we can actually be able to shape our future by making sure that as many people as possible are mentally fit.